What is trigger finger? Trigger finger is in many stages. Initially, there is a pain in this area, in the knuckle volar aspect or palm aspect of the knuckles. And slowly, when inflammation increases, then physically the movements get restricted and finger gets stuck like this, and it opens with a jerk just like a trigger. So that is what we call triggering. It can happen because of many causes. It is more common in diabetic. It is more common in people using hands like manual workers, etc. Because of constant wear and tear, there can be inflammation and causing trigger finger. And it is also common in old age group. It can happen in people with racket sports, something like tennis. And there are many other reasons for which trigger finger can happen. But many times we don't know the reason, it just happens and inflammation is there. So patient suffers from trigger finger. So if we want to know what is trigger finger, let's go through the anatomy. This is a model of hand, different layers, muscles, this is the tendon of the finger, and this is the pulley system, which is a very complex system through which tendon goes through this tunnel so that it glides properly and has a better grip on the fingers. So whenever there is a shrinking or inflammation in this pulley, the tendon gets stuck, and because of the inflammation, tendon gets stuck. So if it is swelling is here, tendon is in the side, so tendon gets stuck in flexion. If swelling comes this side, tendon gets stuck in the flexion, and when this swelling goes through the pulley, there is a pain. So if I have to explain you in simple words, I'll say there is a rope and a pulley. You tie a knot in the rope, and that when knot comes to the pulley, it gets stuck. But if you forcefully take it, it will pass the pulley. But again, otherwise, when you are pulling from other side, it gets stuck again. And during the time when it is going through the pulley, there is a lot of force involved. And that is the time when we get pain. So, how to treat? First thing is remove the cause. If someone is diabetic, control the diabetes. If you are using rough tools because of which there is a inflammation in the hand, then change the tools. Racket sports, change the grip, and likewise. Initially, we always start with the anti-inflammatory medicines and physiotherapy and some exercises. If person gets better, then okay. Otherwise, we can give a corticosteroid shot into the lesion, which decreases the inflammation, and patient can get better. But we always advise after the steroid shot, you should do exercises, physiotherapy, so that if there is any residual stiffness, that is taken care. 90% plus patients will get better by these two methods, but 10% patient would not get better by these two methods. So those patients, they would require surgery. Surgeries are very small surgery, very quick surgeries, which can also be done in local anesthesia. In this, we give an incision along the knuckle, a transverse incision. We open and find the tendon, saving the nerves and vessels, and release the tendon, release the pulley so the tendon can glide properly. Though surgery is simple, but we always advise that hand surgeons should be doing it because they know the anatomy of this region, which is a very complicated anatomy. So that if they are doing it, they can prevent tendon damage, nerve damage, and all those things. And within 2 weeks or so, patient gets better, starts feeling better, and patient can go back to their normal lifestyle, which was before the surgery or before the disease itself. So, friends, I'll say if you have a trigger finger, you don't have to worry. The treatment is there. Must see a doctor, a specialist preferably, and go through the steps which we have already said. Surgery is not the first option, it should be the last option. Thank you.